There is a solution for that is sponsored by VARC Solutions. VARC Solutions helps small businesses succeed by delivering expert QuickBooks bookkeeping, consulting, quick-base development, and integrated solutions. If you own a small to medium-sized business that uses QuickBooks or QuickBase, the experts at VARC Solutions can help. In business since 1999, with people who care and the knowledge and experience to solve your toughest problems. Visit varcsolutions.com for all your QuickBooks needs. Welcome back to another edition of There's a Solution for That, where we help small businesses succeed by discussing challenging business problems and best-in-class solutions. All right, welcome everybody to another edition of There's a Solution for That. We have got a great guest and an interesting topic on the show today. Madeline Stiers, who's the Chief Clinical Officer of Hope and Healing Center Institute, based out of Houston, Texas, is going to be here. And thanks for coming on the show, Madeline. We're going to have a fun topic on mental health and also sort of how that affects the workplace. So I know you're considered an expert in this area, so glad to have you on the show to talk about mental health.
Yeah.
So Madeline, thanks for coming, and maybe just start off by introducing yourself a little bit and tell us a little bit about your organization.
Yeah, thanks for having me. I'm excited to be here. So my name is Madeline Stiers. I'm, like you said, the Chief Clinical Officer at the Hope and Healing Center and Institute. We are a faith-based mental health nonprofit. We serve people who, our mission really is to serve individuals and families who are faced with mental health challenges and through education, training, direct clinical services, and research. So we do a whole lot of stuff here. I've been here for 11 years about. Kind of when I started, there was 6 or 7 of us, and now there's about 35. So we've grown a lot. So
Wow.
it's a great place. I'm a social worker. I have my master's and PhD in social work. So I can do direct clinical work as a therapist, but I also do research, primarily focusing on mental illness and religion, spirituality, how those two intersect, but also working with trauma. I am a trauma therapist as well.
Okay. Well, this is, and I'm glad that we're having this conversation because mental health is not just something that affects the individual affected by mental health. It affects really, I think, everything and everyone around them. From my experience, whether it's your family, your workforce, your workplace, there's so many aspects to this that we could go down and talk through. But tell us just a little bit more about your organization. Like, how did you guys get started? How did you come up with like the way of solving or addressing this problem within your organization?
Yeah, so the organization started a few years prior to my arrival. And so we are a faith-based mental health nonprofit. So we sit on the campus. While we're a separate nonprofit, we sit on the campus of St. Martin's Episcopal Church up in the Galleria Tanglewood area. And actually, the church put out like a survey of sorts. They surveyed their parishioners or their congregants and asked them, what do you want our next ministry to kind of look like? What are they hoping for? And what came out of it was not necessarily everything that we do today, but a place for the community and the church to go when they're faced with the challenges of life, right? Everyone is faced with challenges, big and little. And so they were looking for a resource for that. And from that came the Hope and Healing Center and Institute. I mean, it's kind of wild to think that this came from a survey, 12, 14, 15 years ago.
Yeah, it's like, be careful what you ask for. Right.
So we're a pretty big beast now at this point.
I know some of the, like in our business, a lot of the more transformative types of things that we've done within our organization similarly has been due to a survey, whether it was a customer survey or an employee team survey. You get feedback and sometimes you got to go, okay, great. What do we do with this feedback? It's one thing to ask the question, but you don't want to ignore the answers, maybe just because they're inconvenient. It's like, hey, I got this, here's a problem that people are saying that they have. And how do we go about solving that? So I think this is, what you guys did is, and obviously it was a little bit before you, but what you guys are doing is brilliant because you're meeting the needs of people, especially within the congregation, but obviously the larger community now.
Yeah.
Um, so you guys are solving a problem. So that's what we're here to talk about on our show. So
Yeah. It was,
t-
sorry.
yeah, no, go ahead, go ahead.
It was when I started, like I said, there was about 6 or 7 people and maybe 20 support groups like AA, Alcoholics Anonymous, Narcotics Anonymous, Gamblers Anonymous, things like that, the 12-step groups. And and we also did some educational, like CEU, continuing education unit programs, things like that. And I started as an intern. So Matt, the CEO, was actually a professor of mine in my undergrad at Baylor, and he moved here. I was in Houston for my master's. He was like, well, come see what we're doing. And we just we went to lunch and we decided, like, he was starting the clinic. He said, come on as an intern. And I remember there was nothing. And as a little intern, I just went, okay, well, we're going to make this a clinic. And I made it a clinic. Well, we made it a clinic, and it's been really cool to see it grow over the last few years, not just the direct services, but a lot of the trainings and all. And as we talk about, what this looks like in the workforce, I'll share a little bit about the trainings and what we do that help people in different
Yeah,
areas.
that's fantastic. Well, let's just, and we will get to the workforce part of this because I think that's an interesting thing for any sort of business owner, business leader, HR department, et cetera. But just to help the audience kind of get a little clarity on some of the things that you guys do, what would be some examples of the type of mental health challenges that you see, and what are some of those like programs or things that you guys do to help with that?
Yeah, so you can kind of think of the center as in twofold. So we have direct professional and clinical services, and then we have training and education.
Hmm.
So in the direct services, we have kind of what you would think of as standard therapy, a little bit more program directed. So like attendance is required. So we've got therapy services, we have case management, we have psychiatric support, we've got about 35 support groups throughout the week that meet as well. We have our Hope line, which is the phone number for that. Anybody can call it. It's open every day from 5 to 8 p.m. Central Time. If you're just looking for some peer level support, I'll give the numbers and we can put it in the info for the
Yeah, the show
podcast. If
notes.
that's how
Yep.
I'll do it. But yeah, the number for that is 832-831-7337. And that line is, like I said, in the evenings, it's like additional support. So if you're just lonely or you're needing someone to talk to, you can call that. But most of our services, our direct services here in the clinic, are directed at people who are struggling with persistent or chronic mental health issues.
Hmm.
So we all have points in life where we feel down, life circumstances, you lose a job, a relationship changes or challenges,
Hmm.
grief or loss. And of course, you may be upset or distressed about that. And typically we move through that if we've got good support systems or faith systems and things like that. The population we work with is people who are diagnosed with a serious mental illness.
Hmm.
So that can be anywhere from depression, anxiety to bipolar disorder, schizophrenia, PTSD. We even work with people who are struggling with substance use, although not primary. Um, so kind of a bit more higher acuity. A lot of our clients deal
Right.
with thoughts of suicide or self-harm. Um, One of the unique things that we do for family members is we'll sit down. Oftentimes, if you have an adult child, so a child who's 18 or older, you lose access to the rights to their medical
Right.
records, right? Like
Right.
they're an adult, they can shove you out as much as they want. And when you have a child who's, late teens, early 20s, even mid late 20s, who's all of a sudden, diagnosed with, you start to see these serious mental health challenges.
Right.
Um, you parents go, what do I do? And they're totally lost, and this child is kind of icing them out or acting bizarrely, and they just don't know what to do. If you're diagnosed with cancer, your child is diagnosed with cancer, you know where to go. your child's diagnosed with bipolar disorder or, schizophrenia, people go, I have no idea what to do.
Right.
And that kind of shows the brokenness of our system. And so what we'll do is we'll sit down with those family members. And if that person's willing to come, that's wonderful. But we'll sit and walk them through the process of understanding the system that we have and the challenges that they're going to face and the doors that will be slammed in their face. And it's not their fault. They're working through a broken system. And
Right.
we'll help get them to the right care, whether that's here or elsewhere, hospitals, or, kind of like an intense program that we have. So that's typically the population that we work with. We do have resources across the community as well. So if someone calls, who is not struggling that severely with their mental health, but is struggling somewhat, we can refer them out to a therapist in the community that's going to meet their needs. We remind people that mental health is on a continuum, just like your physical health. Like some
Right.
days you wake up and you feel great, and
Hmm.
some days you wake up and you've got a crick in your neck because you slept wrong, or maybe you worked out too hard. So physical health, we think of it like that. We don't think of mental health that way. We think of it as either good or bad, black or white. The
Right.
reality is it's a spectrum, and we
Hmm.
work with people who are on the very ill end of that spectrum primarily.
Wow. I mean,
Yeah.
there's fantastic stuff. And quite frankly, I've got so many questions.
So that's the clinic. And then I'll dive into the training. And
Oh,
do you
yeah.
want to
Yeah.
ask
Tell us about
questions
the
about the
training.
clinic
Yeah. Tell
first,
us about
or?
the training.
Okay. So the training department it's called Gateway to Hope University, and it is our training research education department. What we do is several things, but we have trainings that we used to go out in person, but now it's all online.
Hmm.
Where we train individuals either in faith communities, schools, or workplaces on how to kind of recognize mental illness, how to um, refer someone to the appropriate care, how to relate to them in those situations, and then how to reconnect them back into that community, right? So that if they had like an incident at work or an incident in school, they're not feeling shunned. Like, how do you welcome them back in a meaningful and genuine way? So we have trainings for all of those. They vary different. They vary slightly depending on the location, right? Because like a faith community training is going to look different than a workplace training.
Right.
Our workplace training is called our champions training, and that one's pretty cool. They're all wonderful. Through that, you can do kind of a 2-hour training to get just kind of a 101 on all of those things I just
Hmm.
mentioned. And then we have a deeper training that anybody can take, but it's called our mental health coach training. And that's, I think, about 12 hours, maybe 15, and there's specializations. And through that, you can become a mental health coach.
Hmm.
And oftentimes, those coaches work in faith communities as paraprofessionals or like peer volunteer roles. You learn how to use a curriculum, like a self-help kind of book, to sit
Hmm.
down with someone who may be struggling, but then how to also refer them to an appropriate level of care if it grows beyond their level. This was really implemented, all of these trainings, to identify and fill. We identified and we're working to fill the gap in our mental health care system.
Yeah.
Um, you know, you People with mental health issues typically just hit crisis and they cycle through hospital
Hmm.
systems, and there's
Yeah.
not a lot of in between. There's therapists for people like me who are doing okay and may just be annoyed at their, coworker or something, but that middle kind of working towards crisis, people fall off. And so and accessibility of mental health is really challenging as well, like financially and then
Oh, yeah.
location wise. So these coaches were intended, this training was intended to create coaches to put in places where people go for support: faith communities, their schools, their workplaces.
Yeah.
Um, so people are ready to kind of navigate these challenges as they're confronted with them in these spaces that we know it so often happens.
Okay. Now that's again, it's fantastic stuff. I do have follow-up questions on the
Please.
champions thing, and there's so many things I want to talk about. But I think what's so important about what you're doing is this is not some problem that's over there, right? This is in our hometown, right? In our own families, in our own companies. This is something that we're dealing with every single day at some level. You go to the supermarket, you're running into people that, some people are a little off. It feels like they're a little off, right? And so this is something that truly can impact us on a daily basis. um do Are the services that you guys offer, is there a charge for them, or is it all free? It's like, I know there's various ways of doing that. So how does it work with you guys?
Yeah, all of our services in the clinic are free. So because of that, we do have a screening process to determine that our services are going to be the most beneficial for you.
Hmm.
And then there is a bit of a wait list, although the wait list is very short right now for some
Mm,
of our services. For some,
okay.
they're quite a bit longer. Um, all of that is free. We'll even pay for a person's medication if they need it. It's a
Mm,
great resource. The trainings, there are some free options in Gateway to Hope University. There are some free options, but there are some paid options, pretty minuscule costs. You know, I
okay.
think for the champion, it's $50. For the coaching, maybe 75. It's and a lot of content, a lot of great content in that.
Okay. Well, so let's talk about that champion stuff a little bit more. I'm intrigued. So like let's I mean if you were just like a one or two or three person company, maybe this wouldn't be something to think about, but as your company grows and you get a larger and larger staff, folks that are working on your teams, you're going to encounter folks that have that are challenged with some aspect of their mental health. And so I can imagine either, a business owner or maybe somebody that oversees HR might be the one that would be sort of tasked with, assisting or addressing this type of challenge. So, um, d- is that Champions program? Is that something that a leader within a business could take or participate in some way so that they can at least be more aware of what's going on and how they can address those needs?
Yes. Yeah. The training is really great for that. And that's oftentimes, I think, what happens is either the CEO or the manager or, director of HR, whatever that looks like, the person who's usually ending up with managing these situations takes the
Hmm.
training, sees if it fits their agency's need. And then they work to, we've had it done several ways, kind of mass people like, all of the department heads, depending on how large the organization or business is, come and are required to take this. Just kind of general information. We've had some smaller agencies and even larger agencies say, well, we're going to pinpoint specific champions. So people who kind of rally around their teammates, who are that kind of, even if they're not in that position, they're kind of the
Right.
person that just everyone goes to. So they identify those people and ask them to take the training, and they become this kind of, it's like a peer, but
Yeah.
it's really someone, if you like, I mean, it even happens here. We have a great EAP program. And we'll have people walk in and they'll like staff and they'll say, I don't know how to access that. And we're going, oh, well, here, let me walk you through it. So in an organization that does training in workplaces and is a mental health facility, I still have staff sometimes that are like, I don't know how to go through this process. And so we'll
Right.
sit down. And so it's really like equipping, and we do this every day with all of our clients, family, people that call. So we're very equipped to do that.
Hmm.
But the regular Joe or Sally in working in a corporate business isn't goes, I don't know. I've never called I've never used that part of our insurance. I have no idea. Call
Yeah.
HR. And then sometimes people are, because the stigma is
Yeah.
still there, they don't want to call HR. We
Yeah.
flagged as like, quote unquote crazy. And so these champions can really help direct people to the right resources. They're not intended to be a therapist or the
Right.
person that,
Right.
so we kind of really set boundaries with that too. But it's like, I'm here to
Yeah.
help you, direct you into the right place for care.
Well, somebody needs to be aware of the signs, right? If somebody is consistently showing up late or they're maybe consistently calling in sick. I mean, there's probably some signs that somebody might be going through something hard, or they're every day they come in whistling and happy, and then one day they come in and they're not so whistling and happy, and that continues for
Yeah.
a while, right? I mean, there's probably, if it's on somebody's radar, it's probably easier to spot and easier to address and say, hey, are you if you're going through a hard time, we have some resources for
Yep.
you. So I think part of the training is probably just raising the awareness and being able to spot it when you see it, kind of thing, right?
Recognizing it.
But
Yeah.
I think you hit the nail on the head when it comes to the stigma part, because I think people, they don't want to be looked at differently. They probably don't want to, have everybody in their organization realizing that they're going through either some trauma or through just something they just feel like they can't handle on their
Sure.
own. And nobody wants, it's really, really hard for a lot of people to ask for help. So, so even if it's there and available, so how do you get past that? Like, what's a tip that you might have to help someone going through that to get past that resistance to asking for help?
Yeah, I think people you're absolutely right. People feel that asking for help is a weakness,
Mhm,
because it feels vulnerable and it's hard.
mhm,
When in reality, the truth is that taking the step to ask for help is actually a very brave,
mhm.
strong thing to do, because you've moved through that fear or that anxiety or that concern of being vulnerable. Oftentimes, when I tell people that, it kind of clicks and they go, "Oh." It's still not doesn't make it easy, right? But there's this that barrier is removed from asking for care. And so I think if you had one thing to say to someone that you think might be struggling, you say, "I'm here to offer support if you need it," and it might feel like a weakness, but really it's a very strong and brave
Yeah.
thing to do.
Well, I have a thought on that specifically, just something that I guess we've done a little bit in our company, just so I'll just kind of share it with everybody
Yeah,
when we get to it. But Houston's very own Brene Brown, which I'm sure you're familiar with, she talks about vulnerability all the time. That's like her thing, right? Is
uh,
vulnerability, and that's exactly what you said. It's actually a strength to be able to say, look, I'm struggling here and I need some help. Because you don't isolate yourself as much when you ask for help. And so I think that empowers, and it really facilitates someone being able to step up and say, "Hey, look, I'm happy to help." Um, but I mean, so just putting yourself in the shoes of somebody that is going through a hard time, you don't want to tell your boss, right? You don't want to call HR and say you need help, or hey, anonymously, what are my resources, for mental health? I mean, you're basically saying, you might have a struggle there. So one of the things that we've done here, not so much on the mental health side, but I can see how this would be a good example, would be like my wife and I found out a couple months ago about a benefit through our insurance policy that has a nutritionist. Okay, so it's like, hey, if you're trying to lose weight, if you're trying to, if you're having challenges with sleep, just sort of anything that revolves around fitness, food, macronutrients. I mean, all those different types of things, and we found out that it was included in our health plan. And so I had a friend of mine that had used a service and had phenomenal success, and I'm like, well, let me just call that company up. Well, literally, we haven't had a single bill. I mean, we haven't had a single charge, saying, pay us for these services, but we're going through this. And so anyways, long story short, realizing that was something that we had access to, and that it didn't cost anything, and it's a benefit. I just sort of put it out there within our internal chat and email to say, hey, if you're wanting to get healthier, whether that's physical, whether that's nutrition or sleep or any of these other things, here's a place that you can go. Here's their phone number. Here's their email. You just tell them you've got this particular insurance policy, and they will take care of you. You don't have to go through HR. You don't have to call me and let me know. And
yeah,
so giving people a resource, especially that doesn't revolve around them asking within the organization, they can just call the number. Um, Something as little as that, I think, can make the difference between people accessing it or not accessing it.
absolutely. I mean, and that's part of why we created the Hope Line as well. So as we're working to place people in, these different arenas to be these champions and coaches to kind of help direct people, if they're in a place where they don't want to necessarily ask for help, these people who have been trained can at least put out the Hope Line number and say, like, whether it's a direct resource that that company offers, or that maybe they don't have, it's a smaller company and they are not able to provide mental health assistance through insurance. They can say, here, call the Hope Line and you can get some free support in the evenings. But also, what our operators can do is help direct them. If it's in the Houston, kind of Texas area, we can help get them connected with specific referral sources,
Mhm.
whether it's the Hope and Healing Center or elsewhere. But if they're outside of Texas, which they could call, we'll help get them connected to a place similar
Hmm.
to the Hope and Healing Center, so they can then kind of connect them in their area. Because yeah, I think just having a starting point of like where to call or what to do really alleviates some of that anxiety. And our operators and our staff here are trained to know what questions to ask. And whereas someone like yourself, if someone came to you and asked you, I have this back pain, and well, what do I do specifically about it? You might be like, I don't know, you should see a chiropractor, maybe,
Hmm. Right.
you'd refer them out, right? And
Yeah.
that's the appropriate thing to do. People do that with physical health, but they're not going to do it with mental health until the
Right.
organization can highlight, hey, this is an important area for us. We want you guys to be paying attention to it.
Yeah, no, that's awesome. And in fact, you just touched on one of the questions I was going to ask you. So, geographically, do you have limits in terms of your geography and who you serve and the services that you offer, or is it nationwide? So, just tell us a little bit about that, and it sounds like you've got a network of people that you can refer people to as well. So, tell us a little bit about that.
Yeah, so yes and no. Uh, for our direct services, the clinic, we are a Houston-based clinic. So all of our services are in person due to the nature of them. We don't have virtual
Hmm.
support at this point. Some of it, it's kind of hard to explain, but yeah, it's in person. So the Houston area. The Hope line, however, anybody can call. The last analysis I did, I ran some numbers. It's 39 states we had people call from.
Oh,
So
wow.
yeah, it's a great resource. The training, it's all online. So while we used to be just Houston, because we'd go to these places and do it in person, we've moved it online. That's the way of the world now. So that can be anywhere. I mean, in our training, our coaching training specifically, we've had people outside of the US take it. So it's a great
Okay.
resource for anybody listening, whether you're in Houston, Texas, or anywhere in the world.
Fantastic. Well, I'm going to write this down. So, the Hope Line. What is the Hope Line number?
Yeah, so the Hope Line, it runs daily from 5 to 8 p.m. Central Standard Time, 365 days a year. It's
Okay.
bilingual, so English and Spanish callers every night. And that number is 832-831-7337.
Okay, 832-831-7337,
Mm-hmm.
5 to 8 PM Central Standard Time.
Yeah.
Okay, so basically anybody can call during that time and get basically somebody to answer and talk to a little bit.
Yeah, one of our coaches who's gone through our training, like not they're unlicensed, not professional
Yep.
therapists, but you can get some support through them. And if you're in the Houston area, you can get some referrals, whether it's referred internally to us here or, someone who's got their shingle out in their private practice.
Yeah. No, this is awesome and such a great resource too. So, well, let's talk a little bit more about the workforce. So, what are some of the things that you're seeing presented to you, right, in terms of problems or challenges within a workforce related to mental health? Like, are there certain trends that you're seeing, like some things that are getting better or some things that are getting worse? Or are there particular aspects of mental health that seem to show up a little bit more in the workplace from your experience? Just kind of talk a little bit about that.
Yeah. So overall, as a nation, our mental health is declining
Mm,
significantly. As we see it especially in adolescents and teens, and they'll be entering the workforce in the next few years, right?
yeah.
So it is something to be paying attention to. It's interesting, as a nation, we ignore it oftentimes. Whereas if our children were physically sick, like in mass amounts, we'd be talking about it. But
Right.
this mental health crisis is not something that people want to address. I think they do, right? It's just how and what, and our system isn't aligned for that. So that's something that I see. I mean, some of the research that I've done, even the adults, the young adults, I say young adults, 20s to 40s, 45,
Hmm.
their mental health is significantly declined as well.
Mm,
So that's something to be paying attention to as an employer, that it's not that people are bad employees. I mean, you have bad employees, right? Like that
hmm.
happens, but
Yeah.
people are struggling. And when they're struggling with their mental health, it impacts their relationships, it
Hmm.
impacts their physical health, it impacts their ability to perform at work. I mean, it's across the board. It's not just one area. And unfortunately, at work, there's oftentimes repercussions that kind of come a bit quicker.
Right.
Um, the positive though is that I'm having conversations like this with you. People are
Right.
aware of it. The conversation is not as stigmatized for people to be talking about. They realize that mental health is something that we see those challenges presented in the workplace, and it's not a, oh, just pull yourself up by your bootstraps, um, and just get over it kind of thing. I mean, there are things that you just have to do whether you don't want to do them or not.
Right.
And can we attend to the overall health of our employees, and what does that look like, not just their physical health?
Yeah. No, that I mean, it's so true. And just like I just think of just real world, people walk in the door of the building or walk in the door of the office, and I think there's a fine line between somebody walking in a bad mood, or feeling a little down or having a bad day, versus it being, like you kind of said at the very beginning, something that's chronic, where it is hard to get out of. Whether it's the depression, they're kind of on a downward spiral, in terms of depression. um, yeah, it could be a very isolated event. Something happened, within their cat died, or somebody in their family has gone through, cancer or something like that. I mean, those are obviously very traumatic things, but but yeah, it could be bipolar, right? It could be just manic, or what do they call that? I'm not using the right words because I'm not a professional like
No,
you,
no, no. Like
but just
depression, bipolar
depression.
disorder, schizophrenia, all of those sorts of things.
Yeah,
Yeah, and I think the important thing to remember, because a lot of the population that I'm talking to are people who kind of live in this
yeah,
field. So this podcast might reach people way outside of the mental health realm, which I think is wonderful.
yeah,
The thing to remember is, if you are not a mental health professional, it is not your job to diagnose someone.
right,
You really shouldn't, because it's not helpful.
right.
And you're probably wrong. Um, but if you are noticing, like you're saying, someone, it's people have bad days. Like,
Hmm.
you can have a bad day as long as you're behaving yourself, like be grumpy, look grumpy, be short. Everyone's warranted that. But if you see it becomes consistent and chronic, and it's a kind of a drastic change from what you knew them to be, you
Hmm.
don't have to figure out what the problem is. You don't have to figure out what the solution is, if outside of kind of work related tasks sort of
Hmm.
things. But you can be that person that says, hey, have you heard about the Hope Line? Or if anyone wants cards, we can get cards sent out, so you just have them around. um, and people can take that first step because someone says, hey, here's a resource for you.
Yeah,
And you don't even have to say it looks like you're struggling. You might just say, this week I'm going to give the card to everyone, so
right.
everyone gets it, but so and so who I think really needs it is going to get it too, right? So there's all these ways
Yeah,
that you can go about interacting, and just kind of presenting information to people as a resource, as opposed to telling them what to do or having to solve it. I think people feel like they have to solve it,
right.
and it's like, no, 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 you're not the person to solve it. You're not the doctor. You're not the therapist. Get them
There,
to the right place, though.
yeah, there are there are people that their love language is being able to help people, right? And they want to care for them. They want to take care of them, and that there's probably boundaries at some point that you're crossing on trying to fix someone, and it's not about fixing them, right? It's about giving them resources so they can get help. um Sounds like, if there's a card, you could even put that in your bathroom, right? It's accessible
Mhm.
to everybody that walks in the bathroom. And if somebody sees it and says that's not for me, great. But if somebody sees it and
Yeah.
says that's exactly what I need, great. Now you've given them resource without, again, reinforcing that stigma. So, well, just in terms of a workplace, how does an employer make it a safer topic to talk about? Um, Whether that's safer for somebody to raise their hand, visibly, or via chat or email saying I need help, but like, just how do we make it a safe topic to discuss?
Yeah. I think there's multiple ways. The Do our training.
Yeah,
Offer the training to people. That's
yep,
one option, right? But really what I'm saying is, if you're talking about it as the leaders or an owners and department heads, managers, if you're saying, hey, like I did this training on mental health in the workplace, blah, 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 it was really cool, and people are going to go, oh, we're like talking about that, okay, so when the conversation starts to come up, and that doesn't mean you go, hey, listen to what I told my therapist yesterday in therapy, right?
Right.
Like boundaries. I'm still understanding we're in a workplace, but making the conversation and the topic not taboo. You sent some information kind of via inter organizational chat
Hmm.
about a nutritionist.
Right.
Doing something like that, like, hey, we've got this, we have an EAP, or we have this resource, or I did this podcast and I learned about this resource called the Hope Line, or I heard this podcast. I just wanted to let everyone know it's a free resource. It's available if anyone needs it. Here's the link to the website or the phone number. Just kind of pushing things out there and opening the door
Yeah.
for that conversation.
Yeah.
And it really does have to start. We talk about this in faith communities too. Like, it has to start in the pulpit. It has to start with the leaders.
Hmm.
They have to be open and willing to say, like, hey, this is a topic we take seriously.
Hmm.
While we're not the professionals, we want to help get you connected to the correct resources. And we've actually either done some training or offering training or just opening the door, that line of communication.
Okay, well, that's my takeaway and action item for today. I'm going to go do that. As soon as we're done here, I'm going to go post on our thing and say, hey, there's a hope line if anybody needs assistance with any of these things. So that's my takeaway. And then I think that champions training would be really, really cool too. Um, so let's talk about accommodations. I know that, whether you're a child going through school, right? There's accommodations for folks that have dyslexia. There's accommodations for people who, need more time, in terms of test taking. I mean, there's all sorts of accommodations through different parts of our world and our life. But within a workforce, what are some of the ways that an employer can accommodate people with mental health? Uh, um, I don't even know what the next part of that statement would be, but just how do we accommodate people that are going through a
Yeah.
hard time? Or not even,
So
I'm thinking, in fact, it's not even folks that are going through a hard time, because mental health is not a thing
a
you
hard
just
time.
get
Yeah.
over when you are no longer having a hard time, right? It's something you're dealing with
Spectrum.
all the time,
Yeah.
right?
Yeah. It's something to care for consistently, just
Yes.
like our
Yeah.
physical health. Our mental health is
Yes.
something to be caring for and attending to consistently.
Yeah.
If you so like an easy thing to do, and you see it coming up more and more, is with PTO days, having designated like mental health days.
Mm,
And you can how you do that as an employer, it's dependent upon your comfort level and whatever, but you can just say, hey, we're adding another PTO day, consider it a mental health day. Or do you want to like make them go through the online system to register it as a mental health day? If you've got a large organization, that could flag it to say like, hey, send them some resources as well or something. But adding that, we see a lot of people adding mental health days. It's
okay.
kind of funny. Growing up, I remember my mom in the 1900s, as the kids say now. Um,
Uh-huh.
she'd be like, if we're having a rough day, she'd be like, do you need a mental health day? Do you need to stay home from school? And I remember hearing that term
Hmm.
so long ago, and I think it was pretty rare. I don't know if she is ahead of her time.
Maybe so.
She was on top of it, but I think, yeah. So your question, I went down a rabbit hole. What was your question?
Oh, just how can we better accommodate
Yeah.
people with mental health within a workforce?
Yeah, I think, um, just like with anything, boundaries, right? So not saying, oh, we'll do whatever you need, kind of, because we don't, policies and rules were made for the few, not the many.
Right.
Um, but taking account of like, are people asking for, some work from home days? Are they needing that? Can they still do their job if that's the case? If you're seeing more and more people struggling, if you have a team and your whole team is struggling, either you've made some interesting hiring decisions, or maybe you need to take a look at their load, right? Like, what is going on? Do we need to look
Right.
at resources for bringing in another person, not for more work, but to take some workload off these people? Surveying, like you said, asking people anonymously for information and feedback on what could be changing. Um, it's it's addressing the mental health support that the organization or the the business is offering, but also
Hmm.
taking a look at what are our internal workings and what are we doing right now that is working. I'm not saying make a huge big change, but are there small little things that we can
Yeah.
do? I mean, people who have chronic disabilities know that they can go to HR and kind of submit through the HR process to have
Right.
some of those supports done. But if you're looking just like generally to support people in their mental health, I know if someone gets sick and they're like, I gotta leave, it's 2 hours early. It's like, are you gonna make them take a PTO day? Um,
Right.
or are you gonna just say, yeah, whatever, if someone's like, I just don't feel well. So allowing people flexibility as long as they are
Yeah.
getting their work done, I think is an important one.
Yeah. No, I love that. And again, I try to be like fairly real and transparent with this stuff. I mean, we've had just within our own organization, we've had a lot of those types of things. People that, you know, get into a verbal altercation, and it just kind of messes with them, and they're like, I just
Yeah.
can't function right now. That the whole concept of being triggered, and then that sort of like that inner dummy, I think, is like one of the maybe the non-technical terms, but the inner dummy that kind of starts taking over, where you can't even process things logically or with like normal reasoning skills, because your brain is just overactive. And you get in that state, and it's like you're not good for anybody. You're
Yeah.
not gonna be able to do your job. You're not gonna be able to do your work, or talk to people, in a functional way. And so, when that's come up within our organization, it's like, yeah, go home,
Go home.
you know, or, go take a walk. Do whatever you have to do to kind of recenter yourself, so that you can either come back, or yeah, maybe it's just, hey, we'll see you tomorrow. Um, and I think those are things that we can do very easily. And in the grand scheme of things, it's not like, oh my gosh, somebody's taking advantage of us and we're paying all this money and not getting any work out of these people, that kind of stuff. But, if it, and like you said, if it was, there's some other thing that needs to get addressed. But,
Yeah.
um, yeah, so I think that's really good. Again, just to be mindful of it, and be aware of it, and be sensitive to that. It sounds like.
Yeah, I love that because that happens to everyone. I mean, we've all had interactions. We walk away going, "Whoa!" Like it just feel rattled. We
Hmm.
call it dysregulated in the
There
therapy
you go.
world.
Yeah,
But
inner dummy slash dysregulated.
yeah, but you can't kind of get back to it, right? Like you
Yeah.
feel like maybe shaky or icky, and like
Mhm.
you're like, I can't even focus on anything. And
Yeah,
and you're right. At that point, you're not good to anybody. You're going to be miserable. Like, if you need to
yeah.
go home, go take care of yourself. Um,
Well, and so I've got a very personal example in this, in that within my own family, we've had some bipolar-ish type of challenges. And and it's hard to have a conversation with somebody when they're in a manic state, or in a very
mhm.
depressed state, when they're dysregulated, as you said. And and at some point, it's like talking even more right now is not going to help the situation. They just need to go cool off in their room, and maybe in a couple hours we can have a conversation about whatever happened, right? But
Ex-
um, I think those are things that we just need to, as best we can, be aware of and sensitive to, and give people space, right? So,
Yeah.
um, as we get to the uh, tail end of the podcast, let me just kind of ask about benefits. Like, I know there's different insurance policies, United Health, there's, Blue Cross Blue Shield, et cetera. There's a lot of different insurance companies out there. Are there, have you seen any, like, if you've got more of this, maybe this is the type of insurance company or policy that you ought to be looking at? Or, and I know you're not like an HR expert or insurance expert, um, but I'm just trying to think of, like, if we were trying to create a better place to work, and part of that is the benefits package that we have for our employees. It includes PTO, it includes sick time, maybe it includes mental health days. There's all these things that we can provide as a benefit to our employees, to have a great place to work. Are there any things that you see from an insurance or benefit perspective that we ought to consider adding or
Yeah.
looking into?
Yeah. I would say an EAP, so an employee assistance program. Uh,
EAP. Okay.
Is a great benefit to have. I mean,
Okay.
we have there's a, just like with insurance, there's a whole spectrum of what level of EAP you can get. And as you said, I'm not an HR specialist, so I can't
Right.
give you details on that. I know we have a really great one here for our employees. Um, because we're an Episcopal entity, our insurance is through the Episcopal Church, and it's wonderful. Um, we get, you know, I think it's between 10 and 20 free therapy sessions a
Hmm.
year, and they can kind of cycle them so they can kind of get more if they need it. But
Yeah.
it's not through our agency. It's you just like you see a doctor and that's kept private. You call our EAP system, they ask you some questions. They will then send you a secured list of therapist referrals that are within your network,
Hmm.
and then you call them and get set up, and then you have a therapist, and you can try different therapists and they'll restart the session times. Like, if you got 10, they'll restart that.
Okay.
um, huge benefit, because some larger employers will have an EAP, like an employee assistance program that's internal, and
Hmm.
a lot of people will not access that because,
Right.
like, what my bosses may have access to some of this information. So this is a separate EAP, and a lot of people will
Right.
utilize it very quickly. It's also available to family members.
Mm.
So even if I was, like, a single person on insurance, and like I didn't have a spouse on it, like my EAP for me could include that spouse. So it's a unique kind of function of it, or children.
Okay.
Um, and then there's different levels of, I don't know if it's, again, not an HR specialist. I don't know if it's benefits. It probably is, or if it's disability, or if it's associated with like short-term disability. But having access to
Okay.
behavioral health care in the sense of like partial hospitalization programs,
Okay.
which would be like, or detox substance use treatments.
Right.
Having a policy for that. If someone comes to you and says, I'm struggling with substance use,
Hmm.
getting, like, they're able to retain their job if they attend, a substance use treatment for 30
Right.
days and they come back and they're able to meet their work metrics, things like that.
Right.
So there's a lot of different options. There's hospitalization stays that insurance can pay for. But the easiest, most accessible, I think, option is providing some sort of EAP
Okay. Got it.
through insurance. Yeah.
All right. I love that. Um, because like the, you talk about substance abuse, and I think the opposite of that is like if somebody's on meds to help with the bipolar, to help with depression, to help with schizophrenia, whatever it might be, and then they stop taking the meds because they're feeling fine, right?
Ugh,
Again, I've got some
very common.
stories I could tell about
Yeah.
all this stuff. But I think that's one of the biggest challenges, especially when the folks get over 18 and maybe they're not in the house anymore. um, they're feeling fine, so they just stop taking their meds, and now they're in this spiral again, and that kind of stuff. And so I can see that there's a number of ways that um, people can get into a situation where they need help, or but it's good to know that there's resources out there like you guys to be able to help. So, is there anything else just sort of on this topic in terms of what you guys do or how you help that we haven't really talked about that maybe you're like, don't forget about this?
Oof, I don't know. We've got some really great opportunities to support the Hope and Healing Center.
Yeah, tell us about that.
in in this, so we just had our luncheon on the 9th, I think it was a couple of Thursdays ago. And we had Elizabeth Smart as our speaker come and talk about her experience with trauma, her kidnapping, which was a big national
Oh my gosh.
sensation in the early 2000s. So every year we have a luncheon that you can purchase tables at, and help support. We've got some great speakers. We've had Jeff Bagwell in the past, and so for some sports fans out there.
Hmm.
We have it coming up. We will have a spring breakfast, which those details haven't been announced yet, but if you can subscribe to our email list through our website, hopeandhealingcenter.org. And we also have a spring open house. So if you're interested in just kind of learning a little bit more about the Hope and Healing Center, again, all that information will come out as we kind of hit the top of the year.
Yeah.
But you can come actually check out the facility, talk to the staff, hear about what they do, and learn a little bit more about the Hope and Healing Center. So some unique, cool opportunities to really support us and help us continue to provide the therapy services for
Yeah.
free. Our facility is not, like I said, on the campus. It's of St. Martin's. It's in the Tanglewood area. It's a really great, really beautiful campus. And a lot of our clients, over 62%, wouldn't be able to afford traditional mental health care.
Right.
Um, there's no financial requirement that they have to have met to be a client. We do work with people who come from very affluent backgrounds, because
Right.
mental health does not discriminate, right?
Right.
But most of our clients wouldn't be able to afford any sort of care. And so through the graciousness of our donors and support, we're able to
Hmm.
continue to offer the free services that we do. And we're one of the few in Houston that provide this level of high acuity therapy for free.
Yeah.
So
Okay. I
yeah.
love it. So how does somebody get a hold of you? Well, like, what's the website again?
Yeah, let me double check because I don't want to give you the wrong website. And listen, hopeandhealingcenter.org. We have several websites, but that's the main one.
hopeandhealingcenter.org, all spelled out.
Yes, yes. And if you backslash support dash us, that's how you can support us. Then you
Okay.
can navigate around on the website, and you can contact us through the website as well. And all of our support groups and services are up there. So if you're looking for details about all that, it's on the website.
Okay, awesome. And I didn't think of this question before, so
Sure.
I'm gonna try to slip one in right before we close. So like you talked about how people can attend or sign up for the Champions course for more of the workforce based or work place type of help and training. Do you guys ever go out of your building and go to a company and talk about this topic or talk about mental health? And is that another option in terms of, at least in the Houston area?
We have done that, yeah. If they're looking for kind of a larger scale training implementation into your organization or your business, we do suggest the online one. It's kind of easier to
Right.
infiltrate into everyone. But we have gone out and done some live trainings to talk about what the champions course actually looks like, and just kind
Yeah.
of give like a broad overview. We also have an online version of that, which is the Empower training, and that's 2 hours. And so if you're
Okay.
interested in kind of a snippet of what these longer trainings are, the Empower is another option as well.
Okay. Awesome. Well,
Yeah.
Madeline, this has been a fascinating topic and fascinating discussion. I really appreciate you taking the time to come share what you guys do and how you guys are out there helping people within that mental health space. So again, thanks for coming on the show.
Yeah, happy to be here. Thanks for having me.
Absolutely. And for those of you that are watching and listening, again, I hope this was valuable to you. Hopefully you'll take the message that we kind of shared here today, and try to break through some of those stereotypes or stigmas around this topic, and really go out of your way to make it safe to talk about this topic, make it safe to have conversations about this, and then, but more importantly, to provide that support that people within your company might need in this area. So thanks for watching and listening, and we will see you again in next week. There is a Solution for That is produced by VARC Solutions. This episode was produced by Ashley White and Aaron Riley. You can subscribe to this podcast on Apple Podcasts or Spotify. Watch the video version on youtube.com/There's a Solution for That. Or visit varcsolutions.com/podcast, where you'll find our entire podcast archive, as well as show notes, links to solution providers, and complete transcripts of every episode. If you love the podcast, please leave a review with your comments.